It also just comes to the conversation of culture and what treatment is. Coming from a background of being Kurdish, a lot of times, like, as many people have said, dental care wasn't a common thing. And so going in constantly to get care, it was either terrifying because your first round, but on the alternative, it also just comes at like, and this is touching from a point Jackie talked about in our breakout room, is so many people go for the most expensive option of going straight to the emergency room. It might just be something that they don't know isn't an emergency. It's just something that they do not understand what it is. And that's the first option you hear. Because whenever you pick up the phone for a healthcare provider, your first thing, and as much as it's a liability, it's if it's emergency, call 911. And for someone who doesn't understand that, like, is this something severe or is this something I just haven't seen before? That's their immediate reaction is let's go straight there. And that puts them into this rabbit hole of, oh, if I get healthcare or if I go get care, there's so much more I have to pay for all of a sudden.
You know, the other side of that is, you know, we could design our health system to acknowledge that fact. You know, it's probably easier to change our health system in some ways than that culture, you know, but, you know, but we just demand that people, you know, fit into this health system that we've created. So
I think one of the things that I've seen is that I think many times there's so many assumptions that we make and that individuals in the healthcare system make when it comes to individuals and communities that are very much disproportionate. And those assumptions, I think many times is what's really holding us back in terms of how we really can provide the best, you know, quality healthcare for those individuals that are disproportionately affected by many of the disparities. And many times when poor people enter the ER, yes, that to them may be an emergency, but are we even at that point of access meeting those individuals where they're at? And many times I would probably argue we're not, because meeting them where they're at means pulling back those layers, going under those underlying issues to see, you know, why they chose to come to the ER, or, you know, just many other factors and things like that. But I think we just get stuck at the assumptions of what we think individuals are or the environments they live in, and we're not willing to meet them truly where they're at.